This is my ID, and I don't have a note card. You guys can wave to the camera so that we can hear. Let me begin with a short story. Drew Calver is a high school teacher from Texas and was at home relaxing with his 2 little daughters. Then, out of nowhere, he collapsed on his bedroom floor from a heart attack, and panic ensued. Hearing the cries of his daughters, the next-door neighbor came and rushed Drew to nearby St. David's Hospital. Drew's life luckily was saved after receiving stents in his heart and spending 4 days in the hospital. As he checked out, the hospital said, "That'll be $108,000, sir." Drew was stunned. He did not know that his insurance did not cover St. David's Hospital. This is one of many medical bill horror stories that occur every year in the United States. Today, I'm here to persuade you that the US government must fix the current healthcare system and implement healthcare that covers all Americans. I've been exposed to this topic through my finance major, but I've learned the most through my extensive research on this topic. Understanding my argument is important because someday down the road, there may be a day where something unexpected happens to you or someone really close to you, and you'll want to know you have everything in place in order to make sure you get back on track regarding health. I will first begin today by discussing the problems of our current healthcare system. Then I will continue to explain the solution of universal healthcare, and finally explain what our future will look like with and without this solution. Let's first begin with the problems of our current broken universal healthcare system, or current healthcare system. A report in 2018 by hundreds of collaborators did a study where they compared all the healthcare systems of the world and found that the US spends the most per capita on healthcare, but we are ranked 29th in healthcare access and quality. We are not getting the most out of what we pay for. Additionally, I find it surprising that the US also has less doctors, nurses, and hospital beds compared to the average developed country, according to an asthma study. Additionally, a CDC report in 2019 found that over 35 million Americans are uninsured. This is a problem because these people have to live risky lives in order to save money, but also not having health insurance is associated with poor health and even an increased risk of death, according to a study done by a Columbia researcher this year. I have had many friends who have been slammed with medical bills similar to that of Drew Calver. The president of the World Health Organization said on Human Rights Day that the right to health for all people means that everyone should have access to the health care they need when and where they need it without suffering financial hardship. So let's look at the solution that I propose, which is that the US prioritize healthcare further and implement a universal healthcare system. Universal healthcare would mean that the US government would cover health insurance for all Americans, which means no one's left out in terms of health coverage. Universal healthcare also would centralize things. That way we get rid of some of the complications that we face with regards to insurance. Remember how we were ranked 29th in healthcare access and quality? 26 of the 28 countries ranked above us currently have universal healthcare systems, which means we are likely to be successful according to the International Citizens Insurance this year. One of the first objections that comes up to universal healthcare is that the quality of care will drop. However, this is not the case, because with the solution that I present, where the government just covers our insurance, we still have choice for who and what care we want, and that means the healthcare providers have to keep up their game in order to get business. Another objection is that the government won't have the money to pay for the health insurance for us. The first way I propose to do this is by reallocating some of the large proportion of defense spending, which is the largest slice of this pie, to health, which is a small purple slice on the left. The next way I propose we cover this cost is by taxing the highly wealthy. However, if you're highly wealthy, you're likely to say, "What's in it for me?" The International Monetary Fund did a study in 2014 that on redistribution of wealth and found that as the poor start to do better, the middle class start to do better, which in turn helps the wealthy do better. Additionally, in 2020, a study by PLOS, which is a highly reputable research organization, did an analysis on previously proposed universal healthcare systems and found that we would save about an average of 3.5%. This means that we're not only implementing a more encompassing system, but at a lower cost than before. Finally, let's visualize our country with and without universal healthcare. If we choose not to implement universal healthcare, then years down the road, we will see skyrocketing prices of insurance. Companies will continue to exploit us, and many people in our country will continue to live life on the edge, uninsured. A research book done by Dr. Kunath in 2012 found that with the current growing population, healthcare prices were going to rise for each individual if things did not change. If we do choose to implement universal healthcare, our country will see improvements like never before. We will be a country with more economic booms. We will be a country with more economic booms, and we will be a country where every child, every grandparent, every parent will not have to worry about something as important as health. Imagine a future where Drew Calvert never has to get shocked by $108,000. To bring everything together, I call on the US government to implement the policy of universal healthcare. However, it starts with a simple step from you, which is at elections, making sure to vote for candidates that support topics like this. Also, don't be afraid to talk about these issues in conversation to help the ball never stop rolling. In summary, we discussed the problems of universal healthcare, or discussed the problems of our current healthcare system, then covered the solution of universal healthcare, and finally visualized the US with and without universal healthcare. I care about this topic not only because I care about my health, but I care about our country's health. Think about the failures of the COVID-19 pandemic. Think about the truth that we're only as safe as our most vulnerable member in our society. Think about a path to success. Then think about the need for universal healthcare. Thank you. These are my citation slides, and now I'd like to open the floor for 2 minutes of questions. Yes?
So with universal healthcare, there won't be any out-of-pocket costs for the person, there won't be any out-of-pocket person himself, right?
Correct. So the idea is that the payments that we make currently are going to be handled by the government, and then even though I'm putting the burden on some of the highly wealthy in my solution, their distribution of their resources will only make them more wealthy because the poor will do better, and then so on. So correct. It's only the government will cover those insurance costs. Oh, another question, sure.
So will we have any savings by using universal healthcare versus keeping our current healthcare system?
So the overall saving done by the study by PLOS showed that previously proposed healthcare programs, universal healthcare programs would save an average of 3.5% overall, which would mean total cost to the country, which is reduced, which is good for our economy because that money actually can go elsewhere. Even though it seems like we're spending more on healthcare, we're actually saving. Yes?
What about the 35 million people right now that are not insured?
They currently are running the risks of not having to pay for health insurance, which if they were to get into an accident, then they could be in the case of Drew Calvert, where you're spending hundreds and thousands of dollars. So yes, they're not paying anything right now, but that risk also is bad for their own health, according to another study that I had provided.
I don't understand how the wealthy get wealthier if they're taxed. Can you explain?
Yeah, so the idea is that there's a redistribution of the wealth, but it's not directly paying the poor people. It's the improvement of their prosperity, so they don't have to worry about something like healthcare, which I'm saying that is a human right. And that means that the poor can focus on their jobs, and then thus they're providing back to the economy, which eventually trickles up to the rich in order for them to get wealthier. So like everyone's moving up together. Yes.
All right. Do you know what kind of what would be covered in your universal healthcare plan?
So the universal healthcare is essentially a replacement of the current insurance companies. So you are covered when you go to any hospital or something like that. Then you don't have to worry about those large medical bills. You're guaranteed to be covered and paying the regular insurance down payments and stuff like that. Thank you.